Hey guys, it's Dr. Ben from Radiant Life Chiropractic. We're here tonight to talk about myofascial release. It's something that I use in practice quite a bit as an adjunct to manipulation exercises, those type of things to help people recover faster. Um, First things first, we're going to talk about what it is. So, myofascial release is kind of a global term for a group of manual therapies. But basically, what you do is you use a comprehensive approach to evaluate and treat soft tissue dysfunction. The main goal is to release restrictions in the soft tissue. So, these restrictions could be trigger points, just tight muscles, or any other soft tissue dysfunction that may be causing pain, weakness, or limited mobility. And usually these restrictions come by from anything from trauma like a sprain strain injury, different musculoskeletal conditions like fibromyalgia, poor posture, repetitive stress injuries are a big one we see in the office for the day-to-day folks. But with myofascial release, what we focus on is the relationship between the fascia and all the other tissue in the body. And the fascia is like a connective tissue surrounding everything else. It's what connects everything in the body. And it's a very important structure that gets overlooked a lot, especially in physical medicine. We tend to focus on just the muscles, the ligaments, the joints, the bones, those type of things, but we forget about what connects it all. And that stuff tends to be pretty important. Now, when we look at myofascial release, the whole idea is to do a couple things that help aid the body in healing quicker. So one, we want to promote blood flow. Chronically injured tissue typically has diminished blood flow. It's not moving as much. There's scar tissue deposition. And if the tissue can't move, it can't pump new blood in and out of the tissue, so it can't bring new nutrients in and out to help it recover. So by promoting blood flow, we enhance nutrient flow into the tissue, and that stimulates recovery. The other thing is we actually use neurology to our advantage. We help to stimulate a neurological sense called proprioception, where our brain sees our body in space via these little receptors we have all over every piece of skin, bone, ligament, joint, muscle, everything in our body called mechanoreceptors. By exciting these, we give our brain better awareness of what's going on in that tissue, so it can help coordinate a recovery. But two, we increase coordinated movement of that muscle group that's affected. Now, as we go through this, we want to know who gets the best types of benefit from this therapy. One, anybody who's had neck pain, mid back, low back pain, fibromyalgia, headaches, sprain strain injuries, shin splints, plantar fasciitis, bursitis, tendonitis. If it ends in itis and it can be treated with an NSAID or something like that, typically we can work on it. Athletes have been a big part of my practice. Repetitive stress injuries with athletes, doing the same thing like golf, baseball, where we tend to only use one side of our body, our dominant side, and we do it over and over and over and over again. We build up muscular imbalances, and we get really tight tissue. If it's not addressed properly, it sets us up for injuries. You have muscles that are too tight on one side, too powerful, and the antagonist muscles, the muscles that counterbalance those, are too weak. They're too loose. They can't create the proper counterforce to stop that movement. So muscular imbalances and repetitive stress injuries kind of go hand in hand. With athletes, those are pretty common, much more common than even your acute injuries, but we do see a lot of benefit with those as well. Now, not everybody is a candidate for this. One, if you have a malignancy, malignant tumors tend to be something we stay away from. Acute rheumatoid arthritis when it's uncontrolled, can often make it worse if we push too hard into the tissue. It creates more inflammation. Somebody with advanced diabetes, so that person who has started to lose feeling in a foot or a hand or something like that. Once again, patient feedback is a really big part of this. So if they can't feel it and can't give you feedback, you can do some pretty good damage if you push too hard. And they're not getting the proper nutrients to the tissue anyways. That delivery system is very compromised. So it's going to be hard for them to recover. Another thing we try to stay away from is severe osteoporosis. I don't want to push too hard. You can break a bone. I'm not all about that. Try to keep away from that as much as possible. And on that side of things, any healing fractures, we want to stay away from those and let them do their own thing. Body takes pretty good care of those on its own. Now, as we go through this, what are we looking at? So there are different types of myofascial release. Like I said, it's a very global term. We look at anything from in the athletic world, people have seen the cupping. That's a form of myofascial release. There's different forms of cupping itself. There's the cupping that's used in traditional Chinese medicine, and even that varies greatly. There's in sports medicine, we tend to do what's called active cupping, where we'll set the cup on the tissue in question over a trigger point or a knot or something like that. And when the tissue is sucked up into the cup, that negative pressure pulls new blood into the tissue. We have that person go through a range of motion to activate that tissue, and that further enhances new blood flow. It's a really, really easy way to break up adhesions very quick and get blood pumping into that tissue. Really good way to warm up. A lot of people see Michael Phelps do it. The type of cupping he did is what I'm describing, and it's very good for getting you ready for competition. Another form of it is called instrument-assisted soft tissue mobilization, IASTM. IASTM, classically, the most popular one is what's called Graston technique. It's with a set of tools that we use to smooth out the fascia. We find bindings in the fascia, and then we just smooth it out, much like that. It's once again very effective. There's different methods, different techniques with it, and it has a lot of success. Another one that we use is massage therapy. That's another very popular one. Don't want to forget that one. Shout out to the massage therapists out there. There are many forms of myofascial release within massage therapy. There's trigger point release. A lot of people are familiar with that. Ischemic compression, where you push into the tissue, pushing all the blood flow out of it, and then the rebound effect, where the blood comes back in, helps to bring new nutrients into the tissue and help it heal faster. And then what I do in the office is a mixture of what's called active release technique and fascial distortion. Basically what we do is we find the tight muscle, we trap the tight portion of the muscle or the trigger point or fascial band, knot, whatever it is, under my thumb or under my fingers, and then we have that person move through a range of motion that helps to loosen it up. It's very effective. It tends to stimulate healing at a much, much higher rate, much quicker. And a lot of my patients tend to like it. They don't like me while I'm doing it, but they like me afterwards. So what do we generally expect to do on a visit is something I hear a lot from prospective patients. So the first thing we do a functional evaluation. We see what's going on. Usually by the time people have come to me, they've already been through the standard medical route. They've been through your rest and ice and compression and elevation. They've been through NSAIDs. They've been through taking magnesium and CBD and all that other stuff. But they haven't just tried something as simple as stretching for most people. It's the most common thing I ask people, how much do you stretch? And the biggest answer I get is, not very much. So we do a functional evaluation. We look at your joint mobility. We look at your muscle strength. and we look at gross range of motion. How flexible are you? How strong are you? And then we look for reproducibility of symptoms. That's in this type of work, that's a really good thing to be able to do. If I can reproduce the symptoms, then I can. Yeah, Bronson, I see you there. Who does stretch? That would be a nice thing. It'd be a lot easier to work on people if they would stretch, wouldn't it? But reproducibility of symptoms. If I can reproduce it, then I can localize it a lot faster. Clinically, that makes it a lot easier. So anytime I can, especially with like nerve entrapments, people, one thing I didn't mention was sciatica. People come in with a sciatica a lot. If I can find where the sciatica is coming from, it typically is a peripheral nerve entrapment in the piriformis muscle in your glute. If I can reproduce that sensation going down your leg, I can probably get rid of it because I've isolated where it's coming from. And then from there, once we've established what's going on, what we need to do to address it, then we get down to business. Treatment typically includes, so if I'm using one of the more hands-on techniques like the active release or the fascial distortion or something like that, we basically just do slow sustained pressure to the tissue involved, have that person go through a range of motion, or I help them go through a range of motion, and then we work to stretch it out. Feedback is the most important thing. I see a few of you on here have been through a couple of those sessions with me. Feedback is very important. I don't know your pain tolerance. Some of this stuff gets painful. A little bit of pain is okay, but I'm not trying to break you in half no matter what y'all think. But anytime I can get great feedback from a patient, the more you can talk to me, the better it is, because I can also overwork the tissue. I don't want to overwork the tissue. I want to push blood flow into the tissue. I want to stretch it out. I want to get it warmed up. And once we've increased the range of motion of the tissue, that's when we want to stop. Going past that, typically we can, a little bit of inflammation is a good thing. That helps the body heal. If we create even more inflammation, though, that tends to have some detrimental effects. But with these therapies, since I've started employing them in practice, I've found, they're very effective. They help to give my patients outcomes that we otherwise couldn't have gotten if I had just done a standard manipulation and send you out the door, tell you to stretch at home. But beyond that, anytime we can create better outcomes, people are happy. People are more likely to come back and see me. No matter what I do to them, they know that the stuff works. So that is important. Being able to prove that these things work is the most important thing. We see a lot of practitioners out there. I'll get on my soapbox for a second. A lot of these practitioners out there that'll do some weird things or not be able to explain why they're doing them. And it just doesn't make any sense with doing myofascial release and these manual therapies. They're effective, they're safe, and they can do a lot of good. But that's about all I have for this little session here. If any of y'all have any questions, you can put them in the chat there. Otherwise, that's pretty much all I got. All right. Oh, and hi, Debbie Ray. I see you there. All right, guys. Well, if there aren't any questions, that's all I've got for y'all tonight. I will see some of y'all later, and have a good night.